What is the difference between maxillary advancement and jaw surgery? Have you ever wondered how certain surgical options can help with sleep apnea? Today, we will clarify the difference between maxillary advancement and jaw surgery. Let's break it down. Maxillary advancement is a specific type of jaw surgery. It focuses on moving the upper jaw, also known as the maxilla, forward. This movement helps to enlarge the airway, making it easier to breathe. This is particularly important for those suffering from obstructive sleep apnea. On the other hand, jaw surgery is a broader term. It includes any surgical procedure that changes the structure or position of the jaws. This can involve the upper jaw, the lower jaw, known as the mandible, or both. In the context of sleep apnea treatment, maxillary advancement is often part of a larger procedure called maxillomandibular advancement. This procedure advances both the upper jaw and the lower jaw at the same time. By doing this, it significantly enlarges the airway from the nasal cavity to the throat. This helps reduce airway collapse, which is a common issue in obstructive sleep apnea. Now, let's look at some key differences. Maxillary advancement alone only moves the upper jaw forward. While this can improve the airway space behind the palate, it may not be as effective as moving both jaws together. Jaw surgery can include various procedures. These can range from moving the lower jaw forward to moving the upper jaw backward. Some surgeries may not even aim to treat sleep apnea. Maxillomandibular advancement is often considered the most effective surgical option for moderate to severe obstructive sleep apnea. It works by enlarging the airway and increasing tension on the soft tissues in the throat. This helps to reduce airway collapse during sleep. The procedure involves making cuts in the bones of both the upper jaw and the lower jaw. The upper jaw usually requires a le fort I osteotomy, while the lower jaw often needs a sagittal split osteotomy. After the bones are repositioned forward, they are stabilized to improve airflow. Many patients with sleep apnea have skeletal issues that contribute to airway obstruction. These issues can include underdeveloped jaws. In such cases, both maxillary advancement and maxillomandibular advancement can be particularly beneficial. While maxillary advancement can be a standalone procedure, it is often part of the larger maxillomandibular advancement process. The choice between these procedures depends on individual anatomy and the specific site of airway obstruction. Additionally, jaw surgery for sleep apnea not only aims to improve breathing but can also enhance facial balance and aesthetics. This is an important consideration for many patients. In summary, maxillary advancement is a targeted procedure focused on the upper jaw, while jaw surgery encompasses a wider range of options. Maxillomandibular advancement is the preferred choice for effectively treating obstructive sleep apnea by addressing both jaws and significantly enlarging the airway.